Africa's children have never known a world without HIV or AIDS. Each year, 170,000 are infected, mainly driven by transactional sugar daddy relationships and unprotected sex. As a direct result of our findings, 2 million girls in 10 African countries are receiving economic and social support to prevent HIV risk. My name is Lucie Cluver. I'm Professor of Child and Family Social Work at Oxford University's Department of Social Policy and Intervention, and also at the University of Cape Town. I first realised the importance of this issue when I was working as a social worker in South Africa at the height of the AIDS epidemic. I realised that rigorous research was needed to fight this disease. In 2007, I presented the findings of my doctorate to South Africa's Minister of Social Development. He said that we needed to do a national study. This became our Young Carers Study, the largest longitudinal study of adolescents affected by AIDS.
I have a mother who lives in Eastern Cape. She's unemployed. I think it was on 2008, she got sick, so sick that she couldn't do anything for herself. I had to look after her and wash her and stuff and give her food. The food that was not here anymore, which we suffered to get food.
During this study, a 12-year-old HIV-positive girl died because she could not follow her medication regime. And she was not the only one. This prompted our new study, Mzansi Wako, which is the world's largest social science study of HIV-positive adolescents. In 2011, UNICEF asked us whether we could test if social welfare for poor families could reduce adolescent HIV risk. At this time, South Africa was rolling out child support grants to adolescents and scaling up support programs such as free schools, HIV support groups, and school feeding. We found strong impacts of social welfare policies. In families receiving a child support grant, adolescent girls had a 50% reduction in incidence of transactional sex and a 70% reduction in older sexual partners or sugar daddies. Adding parenting support maximised these prevention effects. Risky sex was reduced by 50% in both boys and girls. The research team coined the term cash plus care to describe this new combination prevention approach. We found that it interrupts pathways from poverty to abuse and school dropout, and further on to HIV infection. The impact of this research has increased exponentially. Governments and policymakers have used our findings to endorse new cash plus care programs in Kenya, Lesotho, Malawi, Mozambique, South Africa, Swaziland, Tanzania, Uganda, Zambia, and Zimbabwe. USAID and the Gates Foundation have established a $385 million HIV prevention program called DREAMS, which now has cash plus care as one of the required set of evidence-based interventions. With the Global Fund, over 2 million adolescent girls and young women in 10 countries are now receiving cash plus care programs. Oh, hi Nicola! The ESRC has supported this work from the very beginning, with my ESRC-funded doctorate.
Today I washed my grandmother's blankets. It was 8 of them.
The initial Young Carers study was funded by the only ESRC South Africa bilateral grant, and ESRC Impact Acceleration support was granted for the Mzansi Wako study. Dr. Franziska Menk, who did her doctorate on this research, is now an ESRC future leader, continuing work in this important area.
I think the potential has always been there for huge impact because nobody has done these large-scale studies before in South Africa. And the South African government has been really excited about the opportunity to actually get data and to base their policies on the findings of actual research that's ongoing. And Lucie has been really wonderful in facilitating a dialogue with them where she goes and says, what is it that you need? What kind of policy question can we help you answer?
Our future research will aim to help those adolescents who've become parents themselves. They and their children are desperately vulnerable, and they need evidence-based ways to support and help. This new research will have major impact for Africa and the world.